Now it's so late in Beijing, so good evening and good morning, dear professions. From the Fifth Medical Center of the PRA General Hospital in Beijing. The topic of my report is application of HIFU for the treatment of progressive stage of pancreatic cancer, a single center experience. We know that pancreatic cancer is called the king of cancer. In 2020, the global cancer registry date showed that the incidence of pancreatic cancer ranked 12 in the global cancer incidence rate. Although not a high incidence rate, but it ranked seventh in cancer mortality. Its development in rapid, its prognosis is very poor, and the 5-year survival rate is very low. At present, the study suggests that surgical resection is a displacement method for the treatment of pancreatic cancer, but about 16% of them have metastasis at diagnosis, and 25% in already local advanced, and only 15% can undergo surgical resection. In recent years, although the disease has made some progresses in surgery, chemotherapy, and other fields, but the long-term survival of pancreatic cancer patients is still not ideal. Therefore, the main direction of research is to strengthen transformation and clinical research and explore precision treatment under MDT mode. At present, local ablation technology is used more and more widely in the treatment of tumors. The main technologies used in the clinical treatment of pancreatic cancer included radiofrequency ablation, cryo ablation, IRE, and HIFU. The role of local ablation treatment is considered to induce reduction tumor load, prolonged disease control time, elevating cancer pain, and improving patients' quality of life. We know the HIFU can lead to variety of biological changes after entering the body. Among them, the effect ablation refers to the structure changes that can produce coagulative necrosis. In addition, some HIFU devices and mouses cannot achieve ablation effects, but can only produce function changes, which is not what we discuss today. So, therefore, not all HIFU are focused on ablation in the clinical application of tumor. Focus of ultrasound treatment technology which can achieve ablation effect is more important. Our center indications for the use of HIFU in treatment of pancreatic cancer included tumor size, physical condition, and treatment desire, and etc. The treatment control indications mainly included the safety indexes of treatment channel or organ function, treatment position, and so on. This is the method and the specific treatment parameters for the treatment of pancreatic cancer in our center. The method of point scanning is usually adopted with an average power of about 400. Try to arrange treatment under general anesthesia. Our previous study showed that HIFU can achieve good local ablation effect in the treatment of pancreatic cancer. In the clinical study of 18 patients, according to the RECIST evaluation criteria, OR can reach 18.3% and the DCR can reach 19.6%. Let's share a few cases. This is a 14 years old female patient with pancreatic neck ductal adenocarcinoma with lung metastasis and significant abdominal and lumbar pain. After HIFU treatment, the pain score decreased from 7 to 2. Pancreatic tumor necrosis was significant. The patient survived for 18 months after combined chemotherapy. This is a 59 years old female patient. She was given 2 cycles of article chemotherapy after surgery, followed by focused ultrasound ablation under general anesthesia. After operation, she was given oral chemotherapy and survived for 24 months. This is a 65 years old male patient with pancreatic poorly differentiated adenocarcinoma. He had received IRE treatment before, and our HIFU treatment time was about 14 minutes. The postoperative pain score of HIFU decreased from 8 to 2. This is a 45 years old male patient with pancreatic tile cyst adenocarcinoma. Tumor necrosis was significant after HIFU without pancreatic fistula and pancreatic and pancreatitis. This is a 59 years old male patient with pancreatic neck adenocarcinoma. After HIFU treatment, the local focused necrosis was significant and gradually absorbed and shrunk. The patient was pancreatic and tile. The treatment channel was established through the spleen to achieve completed ablation. There were no serious complications after operation. The second feature of HIFU is the treatment of pancreatic cancer is the effective control of cancer pain. Our initial and later study have shown that the pain relief rate is more than 94%, whether it's treatment under general anesthesia or not. It can also be seen for literature report that HIFU can achieve more than 18% cancer pain relief rate in pancreatic cancer, no matter whether the ablation effect is achieved or not. Another characteristic of HIFU in the treatment of pancreatic cancer is the effective discharge of the celiac nerve. We have conducted a study to compare the efficacy and the safety of HIFU in the treatment of pancreatic lesion combined with celiac nerve damage. The combined treatment group was treated with HIFU for pancreatic lesion and celiac nerve, where the control group was only treatment with HIFU for pancreatic lesion. The study shows that the OR of both groups can reach more than 82%, and the DCR can reach more than 91%. The pain relief rate and the median pain relief duration in the combined treatment group were 19, uh, 95% and 7 months, where those in the control group were 19% and 3 months, respectively. Comparative studies also show that the incidence of tumor of abdominal tumor progression in the combined treatment group decrease suggested that it might to be related to blocking the pathway of pancreatic cancer along the celiac nerve. The statistics of the complications show that the complication of the two groups mainly included fever, pancreatic injury, and impaired gastric emptying. More than 19% were mild. Relatively, the incidence of the impaired gastric emptying in the control treatment group increased slightly. All complications recovered gradually. Compared with the control group, the recovery time of gastric emptying disorder in the combined treatment group was prolonged. Our studies show that HIFU can prolong the survival time of adenopancreatic cancer. Advanced uh, can prolong the survival time of advanced pancreatic cancer. Both the early study and the paper over the age of 60. The median survival time of stage 3 and 4 patients after HIFU combined comprehensive treatment can reach 16 months and nearly 10 months, respectively. Among them, the median survival time of stage 3 patients receiving HIFU, combined chemotherapy, and radiotherapy can reach about 24 months. In addition, HIFU treatment of pancreatic cancer lesion combined with celiac nerve destruction also seems to help prolong the survival time of patients. The analysis of clinical influencing factors showed that OS could be significantly prolonged in patients with HIFU combined with systematic treatment and ablation efficacy above PR. Briefly discussing several topics. First, not all HIFU can achieve ablation effect. Our studies suggested that ablation effect is a significant factor affecting OS. Therefore, it can be seen in some literature that the survival benefit of HIFU treatment is not obvious, but the local treatment effects is not mentioned, which may be related to the poor effect of local ablation. In addition, we once found a case of anti-tumor immunodistant defect caused by HIFU treatment. This is a 56 years old man patient. Uh, we only performed local treatment of pancreatic cancer by HIFU and did not perform other anti-tumor treatment. The local necrosis of pancreatic tumor can be seen from the follow-up data. The result of the examination 2 months after operation showed that untreated pulmonary metastases were significantly reduced, suggesting that HIFU treatment may lead to the occurrence of anti-tumor immunodistant effect. This is a very interesting case. In addition, the complications of HIFU treatment need to be paid close attention. We know that non-invasive treatment is not without trauma. HIFU treatment of pancreatic cancer is in some treatment center has had serious complications such as intestinal preparation. Therefore, we need to familiarize ourselves with the treatment machines, standardize the technical operation, and do well in the management of perioperative period. Finally, let's me make a brief summary. HIFU has the advantage of non-invasive technology in the treatment of pancreatic cancer, which can effectively uh, alleviate cancer pain, improve the quality of life, and extend the survival time by achieving ablation efficacy and combined systemic therapy, but still need to pay attention to research safety and combine treatment stages. That's my all report. Thank you very much.